Okay, everyone. So in continuing with anti-inflammatory drugs, today we're going to be talking about steroidal anti-inflammatory drugs. So, hold on just a second. Before we understand how to use steroidal anti-inflammatory drugs, we need to understand what they are mimicking. So they are going to be mimicking this naturally occurring hormone called cortisol. And I'm sure you guys have heard about cortisol. Cortisol is a hormone that is released by the adrenal cortex. So the adrenal gland is a hat-shaped gland that sits on top of the kidneys, and it has a medulla and it has a cortex. So the cortex surrounds the medulla. The medulla is the innermost part where adrenaline, which is now called epinephrine, is released at, okay, or formed. And the cortex of the adrenal gland is going to form and release cortisol. Cortisol is released from the cortex. Cortisol, just so you guys can understand, is synthesized from cholesterol. And you know, there used to be, years ago, everybody thought that high cholesterol or cholesterol was all bad and no fats were good. And the truth is, lots of hormones, including testosterone, estrogen, cortisol, are all formed from the precursor cholesterol. The actions of cortisol, it has a multitude of actions in the body, but it's a stress hormone. But the levels of cortisol are going to be higher in the morning, you know, mainly, I guess, I would assume. So people are ready, or the animals are ready to face the day. And the actions of the cortisol are to maintain a proper glucose metabolism. It regulates blood pressure. It regulates blood sugar maintenance, immune function, inflammatory response. So anytime that there is a stress also, cortisol is going to be released in the body. I am going to draw, hold on just a second. Let me see how to draw this guy here. Hold on. I want to draw the release of cortisol. So there's going to be what we call hypothalamus, pituitary, and adrenal gland axis. So HPA, hypothalamus, pituitary, and adrenal glands. The hypothalamus releases CRH. I want you guys to look up on Google how to spell the word, but it's CRH, is corticotropin releasing hormone. And CRH is going to stimulate the pituitary gland to release ACTH, which is also, I need you guys to look up how to spell this word, ACTH, adrenal corticotropic hormone, into the blood circulation. ACTH arrives in the adrenal gland and stimulates the adrenal gland to produce cortisol. Which is interesting because the hypothalamus and the pituitary glands are located in, you know, in the cranium, in the brain. And this relationship right here is very, very tightly connected. So this CRH doesn't reach the whole blood circulation, okay? But ACTH does. When the pituitary releases ACTH, it goes all the way through the blood and it reaches the adrenal glands that sit on top of the kidney so they can release cortisol. Cortisol works in what we call a negative feedback loop. The negative feedback loop means that when you have a good enough level of cortisol circulating in the blood, it and that's why it's the dashed line, because it's negative, okay? It tells the hypothalamus and the pituitary to stop releasing and forming and releasing CRH and ACTH. It says, you know what, we don't need anymore. You can stop releasing those. So they stop when the levels of cortisol drop in the blood. Then the blood, this feedback loop is going to stimulate the hypothalamus and the pituitary to produce more CRH, ACTH, release them so cortisol can go back up in the blood again, okay? So this is important. I need you guys to know this axis, HPA axis, very, very well, because it is going to be on the exam. So, so cortisol is important for a myriad of functions, okay, on the day-to-day maintenance of the well-being of the individual, okay? But it is also called the stress hormone. And we're going to talk about now acute release of cortisol and the chronic release of cortisol. So acute release of cortisol this release is going to happen when you have an acute stressful situation. So like I said, on a day-to-day basis, normal levels, the cortisol is going to be circulating in the blood, doing glucose metabolism, insulin, blood pressure, and everything, okay? Now, in the case you have a very acute stress, for example, you have a car accident, or you are, you know, somebody comes and runs after you to jump you and try to burglarize or whatever, you are going to have a very high increase in release of this cortisol, so you can have an increase in your fight or flight responses. So that happens in animals also, okay? So why does this happen? Because it gives quick bursts of energy for survival reasons. So this is, because of this release, you thought you could only run one block from somebody that's trying to run after you, but now all of a sudden you have this unimaginable energy that you can run actually 5 blocks without getting tired. You are going to have heightened memory functions. And if anybody has been in a situation of acute stress, you're going to remember that you will remember absolutely everything about. Now you don't even remember what you had for breakfast today, but because of this cortisol, a lot of the times when we have this acute release, we have very heightened memory functions that we're going to be remembering the exact color of the shirt of the person, the perfume that we're using or cologne, the smell, the time of the day, how the sky was, and everything. And it's because cortisol is just going to imprint that in the brain. It is going to give a burst of increased immunity. So you're going to be, as you're trying to survive in this fight or flight response, you are going to not get sick, even if it is for 1 or 2 days. And then later on, it may actually, people generally after a stressful situation like that, they actually can get sick. At that point, you're going to have lower sensitivity to pain. So if you guys remember when we were talking about non-steroidal anti-inflammatory drugs, they are analgesic. And cortisol, if you guys remember, the steroidal anti-inflammatory drugs are going to cut the entire inflammatory cascade. So when you have a quick burst of release of cortisol, you're actually going to have lower sensitivity to pain. And that's the reason why people continue to fight. They're like dying, and they continue to fight. And it's like they don't even feel pain. It's because cortisol is allowing that to happen, because it's for the fight or flight responses. And obviously it helps maintain the homeostasis in the body, so you can get through the situation to continue on with life, okay? So this particular, so when I say here, it's the fight or flight response, is something that you can like kick and punch and scratch and do stuff like that, you like gross motor functions, but maybe you cannot put your key in the ignition, and you see this in movies all the times, or your doorknob, because the fine motor skills is going to, cortisol is not there to give you fine motor skills. It is allowing you to fight and have gross motor functions, but not necessarily fine motor skills. Now the problem, so this is all good for cortisol. Now the problem is when you have chronic release of cortisol in the blood, and that is due to chronic stress. So what is chronic stress? Chronic stress has been defined as something that has lasted more than 2 weeks, and that's what chronic stress is. So when you know, family is going through divorce, or jobs are lost, or somebody in your family is sick, cancer, etc. So that is a chronic stress, okay? And the chronic release of cortisol is not that good, because a chronic release of cortisol has many, many side effects. And I want you guys to memorize the side effects, because when we are going to be administering steroidal anti-inflammatory drugs, it's the same types of side effects for the chronic administration of these drugs. So again, impaired cognitive performance, so something that the acute release of cortisol gave you heightened memory functions, now you can't seem to remember anything. So impaired cognitive performance, you forget everything, you don't do well in exams, you forget names of people, things that you thought you should have, it's going to be impaired. Suppressed thyroid function, so all of a sudden people are going to become more hypothyroid. And the thyroid hormone is a hormone that pretty much does absolutely everything in the body, so it's important to have it working well. But that's a problem with chronic release of cortisol. You're going to have this hypothyroid for a period of time, and there it's going to allow you to gain more weight, you're going to be more lethargic, etc. The skin is not going to look so good. Blood sugar imbalances such as hyperglycemia. So remember that cortisol regulates insulin and blood sugar levels. So now it's going to be dysregulated. Decrease in bone density is important too, because the long-term administration of steroids can lead to this also. So osteoporosis. Decrease in muscle tissue. So you're going to have muscle wasting. So it's like a weak individual. And we are going to see this on horses that have what we call, used to be called Cushing's, now it's PPID. Horses that have that, and dogs and people, they're going to have very weak top line. The rump of the horse is going to be very weak, because there's going to be muscle wasting because of the prolonged release of cortisol. You're going to have higher blood pressure, which is a sign of chronic release of cortisol too. So it's not necessarily wonderful. And you're going to have a lower immunity and inflammatory response in the body, which is going to lead to slow wound healing and other health consequences. So like, for example, a person that has chronic stress and chronic release of cortisol at all times is a person that gets sick with respiratory infections all the time. They always with some sinus infections, they're always not well. And that's because the cortisol is limiting the inflammatory and the immunity of the person, because remember, if you guys remember the cascade, okay? So the glucocorticoid, so cortisol has metabolic and catabolic effects. So the metabolic effects, it is going to be carbohydrate, protein, and fat metabolism. It is going to, some of the functions is also to increase serum glucose, stimulate insulin release, and lipogenesis. Lipogenesis is the creation of fat, okay, and burning of fat as well. So that's metabolic, okay? The catabolic effect is the breaking down. So the metabolic effect is the effect for life, okay? The catabolic effect, what is going to do, breaking down things, is that the supraphysiologic, what is supra? Supra means too much, okay? So physiologic, so levels above the physiologic levels, okay, of normal, of steroids can lead to decreased muscle mass and weakness because of this catabolic effect. The catabolic effect is the effect of breaking down all these tissues. In the case of osteoporosis, breaking down bones and breaking down muscle mass, etc. Now, you all have heard the word anabolic steroids, and anabolic steroids are not cortisol. They're going to be testosterone, boldenone, so those types of steroids. And they have an anabolic effect, which is to increase muscle mass, to increase things. So that's what anabolism is, okay? So that's what cortisol has, other anti-inflammatory effects that it has. It is going to, if you guys remember the inflammatory cascade, so glucocorticoids, the cortisol has the exact same function, okay, but it's a normal hormone, and then the steroidal anti-inflammatory drugs were made to mimic the actions of cortisol. Okay, and this synthetic steroidal anti-inflammatory drugs are going to have longer duration of action or shorter duration of action, and that's how they have been created in the lab. Okay, so they are going to have anti-inflammatory effects. Okay, so they're going to be reducing prostaglandin and leukotrienes, both sides of the cascade. Steroidal anti-inflammatory drugs are also going to have immunosuppressive effect. So they are going to inhibit the functions of macrophages and antigen presenting cells. So people that have autoimmune diseases, a lot of the times are put on immunosuppressive drugs. And one of them is going to be steroidal anti-inflammatory drugs because it suppresses the immune system. So the body stops killing its own self. Antibody production is going to be reduced by large doses of steroids. Okay. What are the side effects? So the side effects of prolonged or administration of, the prolonged administration of steroid or anti-inflammatory drugs is going to be, they're going to suppress the release of ACTH. We should also increase here CRH, add here CRH because of the loop. So if you guys remember the loop or the axis, the HPA axis, when the level of cortisol in the body, in the blood lowers, it stimulates the hypothalamus and pituitary to produce CRH and ACTH. When the level is high, it works as a negative feedback. Now, because steroidal anti-inflammatory drugs are going to mimic, more or less, look very similar to naturally occurring cortisol, what is going to happen is that the body is going to be confused, like, it doesn't know if it's cortisol, and it's actually an exogenously administered steroid, such as say dexamethasone. But because dexamethasone is going to be mimicking cortisol, the body gets confused and stops releasing ACTH, CRH, growth hormone, TSH, thyroid stimulating hormone, luteinizing hormone, etc. So it's going to be an imbalance in all of those. There's going to be suppression on the release of these hormones, and that's the reason why on the chronic administration, or anytime, if anybody here has ever had like a sinus infection that the doctor actually also prescribed prednisone or prednisolone, or the 6-day methylprednisolone, if you guys remember, you have to taper the dose. You start out with 6 pills a day and then 5, 4, 3, 2, 1, and you have to taper that, because if you are taking steroids every day, boom, 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 and you simply stop taking it, it's going to, the body has not been producing these hormones here, okay, because it's been suppressed. And then the body is going to enter in shock because they're not producing very important hormones that are needed. So what you have to do is taper the dose to give the body a chance to start producing these drugs again, so they can continue to release, so they can restart to release the hormones, okay? Long-term administration of steroidal anti-inflammatory drugs, which also is long-term chronic stress, happens also, is going to be the increase in body fat. You're going to have visceral, so in the abdomen, body fat, facial, okay, nuchal, behind the neck, and supraclavicular fat, which is on top of the clavicle. So there's all this fat that is going to just continue to accumulate in these areas as a result of the chronic administration of steroidal anti-inflammatory drugs, or chronic stress and chronic release of cortisol. Also, is going to antagonize the effect of vitamin D on calcium absorption, okay? Now, I'm giving you just a lot of side effects, but it's important also that it's understood that these are very powerful anti-inflammatory drugs, very, very powerful anti-inflammatory drugs. And they are used in inflammatory, allergic, autoimmune diseases, etc. Okay? There's going to be, like I said, there's short-term and long-term anti-inflammatory, steroidal anti-inflammatory drugs. So hydrocortisone, you guys know that's that cream, the anti-itch cream. That's very similar. So cortisone, hydrocortisone, they are very short acting and they are very similar to cortisol. Actually, cortisone is cortisol. Prednisone needs to be in the body, gets formed into prednisolone. So generally you need a higher dose of prednisone as opposed to prednisolone. In horses, you never use prednisone because it's not they can't break down prednisone into prednisolone in good enough amounts to have an effect. So you have to go ahead and just use prednisolone directly. Prednisone, because it has to be formed into prednisolone, you have to have, it has more side effects than prednisolone. And then long acting, we have dexamethasone, betamethasone, there's going to be triamcinolone. Okay, so there is all these long acting synthetic steroid anti-inflammatory drugs. These here are going to act, they have hours of effect, and these ones are going to have days to weeks to months. Okay. What are the uses for steroidal anti-inflammatory drugs? So one of them is to diagnose, Cushing's, to diagnose PPID. You can, this disease comes with, its presentation with excessive hair. It's called hirsutism, obesity, fat deposition in different areas in the body. You're going to have poor wound healing. This horse may be insulin resistant, but it's not necessary. Okay, it can be. There is laminitis that can happen. So the administration of cortisol or of steroid or anti-inflammatory drugs can actually lead to laminitis too. And a horse that has Cushing's can have recurrent laminitis all the time, and that's a problem. So horses that have Cushing's, you should very carefully, close to pretty much never administer steroid or anti-inflammatory drugs, because if it didn't have laminitis, it can be just the push that he needed to actually start developing laminitis. Okay. But how do we diagnose? How do we use steroids to diagnose Cushing's? You administer, and it's not very done in horses anymore. It's done in dogs for sure. But in horse, because of the risk of laminitis, it's not very used. But you administer dexamethasone to this animal, and then you have to measure to see if the ACTH levels have dropped. In an animal that's normal, when you administer dexamethasone, the ACTH levels need to drop because of the negative feedback. In a horse or an animal that has Cushing's, it is not going to happen because it's a tumor in the pituitary gland, that it doesn't matter the level that you have of cortisol, just continuously release ACTH, which then leads to the release of cortisol at all times. So that's how you can diagnose Cushing's like that. Other uses for the steroids are going to include hives, also called urticaria, hives. For these kinds of, diseases, so hives is a chronic disease that the animal is going to be treated for a long time. So you're trying to find the lowest dose possible. At any time that you're using steroid or anti-inflammatory drug, you're trying to get the lowest dose possible so you can try to have the least amount of side effects, and also trying to not, trigger a bout of laminitis in these horses. Recurrent uveitis, horses that have moon blindness or just recurrent uveitis, a lot of the times are going to be treated with steroids. Also, there is different formulations for these. Steroids are also used for joint injections, and in that case, you want the ones that are going to be have long-term duration. So this is just photos of horses. So as you can see, this is horses with Cushing's. This guy's here. If you can see, very, very weak back, weak rump. They hang on to their hair. So spring has come and gone. It's summer and they're still hanging on to this very long hair. As you guys can see here, that's called hirsutism. This guy here seems has been having laminitis for a while. And these horses cannot regulate body temperature, so you have to clip them in the summer. They may get really cold in the winter, so they need to be blanketed. So it's important to understand how to deal with these guys. This is uveitis here, and it's a very painful condition of the horse. So if it's just an acute uveitis, you're going to be treating with Benamine, if you guys remember. But if it's something that continues to occur, you may need start to add steroids, and sometimes you have to inject steroids inside the eye if you want to preserve the eye. The animal goes blind, but if you want to preserve the eye. This here is showing hives, urticaria, and this can happen because of like insect bites or anything that the horse has touched outside, so paint or a tree or anything, or also something that he has inhaled, such as pollen, or something that he has eaten. So it can be exogenous, so outside insect bite, or it can be endogenous. And a lot of the times, hives, they come and go as soon as the horse is removed from what's the offending mechanism. But a lot of the times they can get fever, they start to scratch themselves, which they can hurt themselves. So you treat that with also steroid or anti-inflammatory drugs because it's an allergic reaction. Okay. So side effects of steroid or anti-inflammatory drugs, like I said, it is going to be very similar to the chronic release of cortisol. It is generally going to happen with the long-term administration of the drug. Lowest dose is ideal, okay? You need to taper the dose, or if you can have an interval between doses. For example, in the cases of hives, we're going to talk about, instead of giving every day, maybe trying to give every other day the medication, because this horse, if they need to be on steroids, they're going to need to be on steroids for a long time if other environmental changes cannot be achieved. So how to give the least amount possible, okay? Steroids are going to suppress the immune response. So these animals, when they're receiving long-term, and also animals that have Cushing's, when they're receiving long-term administration of these drugs, they're going to be more susceptible to bacterial, viral infections, fungi infections, etc. Okay. Polyuria, polydipsia. So polyuria is increasing urination. Polydipsia is increasing thirst. So these animals, the same goes with Cushing's. These animals are going to be drinking and urinating a lot. Muscle wasting is going to happen, as all medications that are going to cut off prostaglandins. They can cause or worsen gastric ulcers. Like I said, steroids can lead to laminitis in horses, and they should never be used in animals that have Cushing's because they already have a very high level of cortisol in their blood. Dexamethasone is a steroid or anti-inflammatory drug that is very, very widely used. You can give orally as a little packet. It can be pills, and it can be injections also. It is used in higher doses in emergencies, for example, for anaphylactic shocks or spinal cord trauma or shock, and it's medium amounts of dose or lower doses for allergic reactions such as hives, any kind of itching, or arthritis, for example. Okay. And again, for joint injections, you are going to give dexamethasone. Is not very much used for joint injection because it does cause damage to the cartilage of the joint, but it's generally triamcinolone that is used for that, and its long effect also. Prednisone and prednisolone, like I said, horses we don't use prednisone in horses, but when we're choosing short term, it needs to be prednisolone, but obviously this is the veterinarian that is going to make that decision. Fluticasone, it's aerosol, and it's used to control hives, giving us aerosol with the face mask, and it can help the horse because, as we're going to study in hives, the inflammation in the respiratory system is also very great. So it needs to be treated with steroids as well. So if you guys have any question, don't hesitate to contact me.